Hey folks, General Manager Tony Mazzucco coming to you with our weekly Facebook Live update. We're going to get started in just a moment. Welcome back everyone after 2 weeks break from the holiday. I will ask anyone if you can hear me and the sound and the audio are okay to let me know in the comments. I am using a different computer today, so I just want to make sure that my sound and audio is working well. But I do want to welcome everyone to our weekly COVID update. I've changed the title to the weekly COVID and vaccine update, since we can start now giving vaccines as we have more information. And we'll also go over some other updates, and some folks have sent in some questions as well. Hi Catherine, thank you for joining us. I'm going to take that hopefully the sound and the audio works well. We are going to start today off with our COVID updates as we always do. We'll talk a little bit about the vaccine, or maybe even a lot of it about the vaccine, and then we'll get to some of your questions. Great, thank you Catherine. Happy to hear that. We did not pre-test this new computer unit, so I'm glad to know that it's working well. And as the one who actually was able to put it all together, I feel that my IT skills are doing well. Good to see everyone. Paula and Patty, thank you for joining us. So I hope everyone had a wonderful holiday season. We did take 2 weeks off from doing these for the holiday season, and I hope you're all doing well and your families are safe. Before we jump into our COVID updates and our other updates for the day, I just want to take a moment and recognize what went on in the U.S. Capitol yesterday. I think just briefly, a lot of us were shocked and saddened to see what happened. None of us certainly expected something like that to happen, or to see images like that. So I know that a lot of us are dealing with that today and reeling from what was really a terrible, terrible incident yesterday in the Capitol. So I just wanted to recognize that. I'm sure there will be more to come throughout the country, and certainly yesterday was not a good day for America. But we are here. The sun did rise today, and we will continue to do what we need to do. In terms of here in Norwood, for our COVID numbers, we are at 248 cases for the last 2 weeks. So that gives us a per 100,000 rate of about 58.8. Now there's a little bit of positivity in there. Last week's number was a little bit higher. Our percent positive rate, which is the percentage of people overall testing positive for COVID that get tested from Norwood, was 7.45%. Much, much higher. I remember when we were first worried about 2 and 2.5 and don't go over 3%. But that's actually a little bit better than, a little bit worse than last week's, which was 7.15%. There have been 2,740 tests at Norwood Hospital to date, and I believe the testing started at the hospital in early November. This feels like a lifetime ago. The positivity rate of the Norwood testing trailer is higher than the state average. It is coming in at around 10.3 or 10.4%, but that's actually a good number because you need a doctor's note or doctor's orders to get a test at Norwood Hospital. So they're not doing just the blanket, I want a travel test, or work has wanted me to get tested. So early on we saw a higher percent positive level there and a much lower one in the community in general. Those numbers have come close to merging, and we've seen that at the state that they've come closer to merging. Now part of that is that COVID is spreading in the community and throughout the Commonwealth. But we believe we're seeing less of the travel testing. There was sort of a peak of that around the summer when people wanted to be able to go places and travel, so they were going and getting their tests. And of course it's challenging. We want everyone to get tested. We want as much testing as available as possible. But on the other hand, some of that testing is quite a waste of resources. So we've gotten that question about the Norwood trailer, why you do need a doctor's order. It is because it's just sort of medical-only testing, if you will. They're not doing the blanket testing, at least not and having insurance cover it for your just personal choice to travel out of state. And of course, I know most of us are limiting travel anyway. Sometimes we still have to. So it is doctor's orders. Testing is free for anyone who has insurance. So if you have insurance, and hopefully you'll have at least Mass Health in Massachusetts, testing is free. In Norwood, for Norwood residents, we do have a small allowance if you are uninsured, but that will go out quickly because that means there's a cash cost to those tests. But nonetheless, call us if you're having a problem. If you have your doctor fax in an order to the Norwood Hospital testing trailer. The program's been going well. We were actually happy to partner. I want to talk about that for a minute. To partner with the hospital to bring this back. We were able to use some of our CARES Act money to get some of the testing. What we were able to work out is for that allowance for uninsured individuals, as well as sort of our cost of getting it up and running and working with the hospital. From November through June, our cost will be about $46,000 out of the CARES Act funding that we have. There's a town on the North Shore, I don't want to say which one, that has spent $550,000 for testing so far, and their numbers are not all that different from ours, and that was just from like September to December. So I have no idea what they did or what beanstalks they bought. but ours is becoming an increasingly better deal every day when I see that. Some communities did get free testing from the state. However, from what I've heard and doing some research, that free testing is not all it's been cracked up to be. One community in particular I was speaking to, there weren't really enough staff at the testing center, so the community sort of lent some of their staff to extend it. And whether it was an issue in the community or just with the location, but they ended up having such a traffic issue that this community was spending quite a bit of money on traffic details to just manage the traffic. And when we were talking about some of the numbers, this poor community for what it ended up costing them for the free testing was less than what we would have ended up paying for our resident testing. Now that is sort of that mass-wide testing, anybody shows up. So I think Norwood took sort of the balanced middle-of-the-road approach and has ended up having a good result as a result of that. Our testing numbers remain good overall. We've had 3,800 total tests in the last 2 weeks, so we still continue to see our testing numbers creep up. Which is a good thing. So overall, where our numbers have been and they're going, there's a little sliver of positivity. We'll have to see how long it looks out. The last 2 weeks, our numbers have been about flat or down. Now, we don't think we've quite seen a New Year's bump yet, but we think by next week we'll have seen what the Christmas bump will be. I think as everyone knows, our numbers sort of shot up after Thanksgiving, right around then. And if you look at our chart that the health department posts every week, there was quite a bump after Thanksgiving. We may see that with Christmas, but our numbers may be just holding up pretty high, but they've flatlined for at least 2 weeks, and that's the beginning of, okay, well, they're flat, let's see where they go. And I'm talking about total numbers here. So there's a hope that next week's numbers are going to be really important to look at. If it's just slightly up or down, then we'll sort of know we're at least in a holding pattern. And then the week after that, same thing. The next 2 weeks are going to be interesting. We haven't talked about it in a while, but we've sort of said all along, you really need 4 to 6 weeks of data to sort of make a decision and say, okay, we think this is where we actually are. But the last 2 weeks, at least it seems to be holding its own. Now, I could be here next week and the numbers have shot way up, or the numbers have shot way down, hopefully down, but they're going up. I should say, sorry, that they're relatively flat the last couple weeks, which is a good thing. The positivity rate is up, but the actual total cases are down a little bit, so that's a good thing. And testing is still high, which is very important. In terms of restrictions out there on businesses and in the community, the state has extended its rollback to phase 1 of step 1 of this phase to at least January 25th. That's not entirely unexpected. We sort of made our decisions ahead of the state that we wanted to really have more of our workforce work from home, which is town hall closing to the public for the next couple of weeks. All of our services are still available. We just have fewer people in the building. We sort of did that as a workforce precaution to say, hey, we know there's going to be a holiday spike. Get people out of the buildings while there's a holiday spike. The library is still doing curbside and their online services. They're not open for indoor browsing yet. I would surmise, hopefully, by the end of the month, those things will go back to normal or the new normal. But we are, like the state, going to continue to look at our numbers. Outdoor gatherings are still limited to 25, although I don't know how many outdoor gatherings are actually going on given the weather. Indoor gatherings are still limited to 10. That, of course, doesn't apply to schools or restaurants can have more than 10 people. Restaurants, unfortunately, are limited to, I believe, 25% capacity. A lot of other retail businesses are limited in their capacity. Those restrictions will stay in place at least through the end of January, 24th, 25th. But we're hopeful that within a couple of weeks after that, they can start getting rolled back. There's still a 9:30, I don't know if you want to call it a curfew on restaurants. That will stay in effect through at least through the end of January 25th. That's, again, a state rule. Hopefully, if numbers flatline and decline a little bit, maybe we can open back up a little bit, but we do want to make sure we don't open up and then have the numbers go back up. So that's more or less where we are with our COVID numbers and our update. We do want to encourage everyone to please continue to be cautious. If you get the call from the contact tracers, this is one issue we have seen. Please tell them everything that they ask you and just give, overshare information, because all the contact tracing is trying to do is get as many people safe as possible. It's helpful to us. We sometimes still have cases where people don't report gatherings they went to, or, it's, yeah, sure, I took Billy to Sam's house on Wednesday and Sally's house on Thursday, and then that was it. And it's like, well, on Friday you took him to a birthday party with 25 kids. We really need to know about that. It's just about letting people know. The quicker we can tell people and they can spend a few days home, we know quarantine is not an enjoyable experience. We don't want to do that. The health department never tries to quarantine people, but it's just about trying to control the spread, keep it limited, And if everyone remembers, one of the reasons we started lockdowns and shutdowns to slow the spread, it wasn't just the spread of COVID. It was keeping the pressure off our healthcare system. Now, for us in Norwood, it's particularly challenging because we've lost the hospital, and I'll talk about that in a little bit. I wish I had a better update other than we still seem to have no update, other than a promise of a meeting with them in the next week or two to sort of get an idea of where we're going and why we're not hearing anything about things moving forward. But we don't have our hospital. Hospitals are starting to see capacity increase throughout the Commonwealth by staying home, by being safe, by telling the contact tracers all the information about where you've been. It helps reduce that pressure on the hospitals in the region so that they can keep functioning. We would never, the West Coast, you're almost seeing that there might be a need to do some care rationing, and that's not a good thing. The state has activated its COVID surplus hospitals, and they're being utilized, but that's not a good thing either. I don't want to get sent to a hospital in the Otis down in Bourne or out in Worcester or up in Lowell. Nobody wants to do those things. That's not an enjoyable experience, nor is it an excuse to not follow rules and not be safe by saying, well, they've got those field hospitals, so we've got extra capacity, so I'll be fine if I need a hospital. We don't need that. Please continue to wear your mask, be safe. I will say, I think the mask compliance is incredibly high. I would like to think that hand washing is incredibly high and people are doing well. It does come down to a lot of your personal choices. How many people are you seeing? How often are you going out with people? And are you generally trying to be safe? I always encourage folks, when you go outside your circle a little bit, try to be cautious for a little while after you've gone outside your circle a little bit, just to be safe with what you're doing, and that's always a good idea. The holidays, I know a lot of people cut the numbers down a whole lot. My thought is the same thing with holidays. If you go out and you had 5 or 6 people for Christmas, try to really be careful the next couple days about where you're going and what you're doing. That way, in the event something did spread, you're at least stopping the spread from there. So, a little bit of a bright spot in our numbers that they seem to be flatlining, but we'll still need another week or two of data. Now, before we get to questions, I want to move on and talk about the vaccine. And I even titled today's live COVID plus vaccine updates and other stuff, because we can now start actually talking more and more about the vaccine. And one of the first things I want to mention is Norwood is actually going to be providing the vaccine to our first responders, which is great. Some communities weren't able to do this, but the work of our health department, and Norwood's actually coordinating this for a region of about 10 towns, where we're actually going to be sort of receiving and distributing and tracking the vaccine for first responders in about a dozen different towns. We're going to start Monday with our first responders. You may see it on the news. Chief Brooks and Chief Maurice are going to be getting their shot on Monday, and we've scheduled our clinics starting Monday. They're running a couple hours a day for our first responders, and they'll run through the week. We're anticipating about a 2-week period to get all first responders vaccinated, just based on scheduling it out according to their schedules and our ability to distribute the vaccine. We're happy that we're finally able to do this. We are doing this here in Norwood. We'll have some great images out there on Monday, and we'll release some videos and some photos and everything, and we're just thrilled that we're starting the process and that we're able to do it. We're hopeful that local public health will be able to continue vaccination rollouts as the phases expand, but we're happy that we're at least starting with our public safety, so that's police and fire. Now, some of you have seen stories in the media about occasionally a town here or there has gotten their firefighters or their police vaccinated already. I want to be very clear, those are organizations that have broken the rules. We believe in following the rules, and we are following the rules as the state has led them out. There are at least 2 towns I know of that basically lied and played games and tried to jump the line for certain people. And I know we all want the vaccine, we all want to get in line, and everyone has a reason why they should be at the head of the line. And the state is always making some tweaks. There's some questions that come up. A great example is usually your standard mass vaccination plan is you take care of a class of worker, but you also get the support staff in that building. The idea being that, well, police officers and firefighters need to get done, but also their dispatchers need to get done because they are working in the same building performing similar functions. And originally the state said, absolutely not, you can't do that. We said, well, wait a minute, our dispatchers do prisoner watch, they're interacting, how can we not do that? And the state took a step back and said, okay, that now makes sense. So while it's always changing, there are a couple of organizations out there, 2 different health organizations that I can think of, and I don't want to blame Quincy, and there was a town that started with N, either Norfolk or Norwell, that just jumped the gun. And, I'll be completely candid with you, that's borderline fraud. You always have to give the vaccine if you have it available. So what the health department will call it is, available arms. So it might be a case where, hey, we've got 2 doses left and we run out for the day, or somebody didn't show up. We're not going to lose that vaccine. We're going to make sure it goes to somebody. But to just wantonly sort of go and pick other groups of people and order false numbers so you can try to break the rules, I think that's wrong. I think when society starts doing that, and when government agencies and private entities start doing that, it's just not right. There's a system. The system will never be perfect, but we're committed to following the rules as they are. This first batch is also very small. It is first responders, and the language is very clear about what that means. Once we get into phase 2, if local public health is involved, there will be many more vaccine doses available. The rules sort of loosen up a little bit, but we're following the rules as they are. Sheila, I think it's a great comment. I'm happy to wait my turn on the vaccine too. We don't know where town managers fall on the vaccine plan. I think I called the state and they said, on the one hand, because I'm sort of typhoid Tony with spreading COVID and getting it so early, I might be pretty high in the list. On the other hand, I might just be a general office employee and waiting until the summer like everyone else. But whatever my turn is and whatever the rules say is what I'm going to do, and that's what we want everyone else to do. The rules say public safety can start on this coming Monday, and that's when we're starting public safety this coming Monday. The health department's been working diligently to get it together and working with Chiefs Maurice and Brooks to make sure we're ready to go. So we're thrilled. We're happy. Our first responders are finally getting the vaccine Monday. It is the Moderna vaccine. There was something sort of quite fitting about we would definitely get the Moderna vaccine here in Norwood, where most of the precursor ingredients are being made here in Norwood. So we're particularly happy about that. A little bit of happy or positive irony there that Norwood would, of course, get the Moderna vaccine. So we're happy about that. There's the next likely step in February when we move on to the next phase. I believe the next actual step is congregate care homes or group homes, is likely to be teachers. There's sort of that big phase 2, which is a lot of groups, but we believe the priority in that group, and so we're going to push it, is to be teachers so we can start getting teachers vaccinated. Again, everything changes, the amount of vaccine available. We, of course, have more teachers than we do first responders, so we, as an example of a microcosm of the state or the country, would definitely need more doses available to do that, probably in the 500 or 600 range, but we're hopeful that they'll be at the top of that list. That way we can start getting teachers vaccinated. If we can start by, let's even say mid-February, you'd be looking at hopefully all teachers having both doses by the end of March. And the benefit to that is we might be able to have kids back in school in April vacation. Now there's a lot of complexity over that. There's still, youth aren't on the list. Collective bargaining agreements, DESE rules, we all know that. That's all still to be coming to be dealt with. But when you think about it, that's a critical sort of juncture point when we can say all teachers have been vaccinated. I think that's great. Public safety, and then we have to get teachers next. Hospitals are ongoing, nursing homes are ongoing, and that will continue as it goes on, but the bulk of their staff will get taken care of by the time we move on to the next phase. So we're happy about that. In terms of the overall rollout, there's been some confusion. Local public health has been doing this for decades. It's nothing new to us. In emergency management as well, we've prepared plans, we've drilled on plans. This is really nothing new. I think there's some people in government in different areas that maybe didn't realize how much planning has gone into this. I also don't know if it's a function of all the vaccine isn't necessarily available right at once. So you sort of have to have a rollout instead of just doing a true mass vaccination where we say, all right, Norwood, you got 30,000 doses, 30,000 people, let's go. We were prepared to do that if that was the case. The vaccine seems to be coming in smaller pieces. And that's not necessarily that there's a production issue. Just think about it logically. If we needed 30,000 doses in Norwood and we had to wait till we got our 30,000 doses and everyone else had to get theirs, we could probably do that and kind of get everyone done in one big shot, but we'd be starting it in June. So do we wait till June and get everyone all at once over the course of a couple of weeks in sort of a massive drive-up clinic? Or is it, hey, some of it's available in February, get it out and get the first responders, or in our case in January, get the hospitals taken care of, then get the first responders taken care of. So I think that's why it's been a little tough, and it's complex. That next phase, so okay, we've got K-12 educators, but then you gotta realize, well, there's janitors and cafeteria workers and admin staff in those buildings. Okay, so you should probably take care of them. Well, what's a utility worker? Well, that's very easy. A lineman, we want to get the lineman done as soon as possible. I tried to get the lineman done first, arguing that Moderna couldn't produce the vaccine if they didn't have electricity, but I don't know if that argument really won anyone over other than myself. But, our public works employees, our water and sewer employees. But then wait a minute, what about electricians and plumbers? They are also essential utility workers. And then what about people, the people that come and fill my oil tank? Oh, I need oil, that's essential. So it becomes tough that phase two is going to be pretty big. I think what you'll see is more of a breaking out of that group of phase two into different little subsets, just to kind of break it up a little bit more. And then we're hoping that mass vaccination can start to the public May, June, July, somewhere in that time frame. I'd like by July the majority of us to be done. I keep telling everyone we're planning on Christmas in July. We normally do like an employee holiday party. We're going to do it in July. We've had some retirements of staff. We're planning to have retirement parties in July with the assumption that most people will hopefully be vaccinated by then. And maybe we'll even put holiday lights up all around town and just call it Christmas in July, just as a way to celebrate some of the things we're missing out on now. So there's been a little bit of confusion, but it's really, on our end, it's more or less been just waiting for information, and once the information's come out, it's as reasonably clear as information on anything else. There is a state website that you can go, and it can tell you where to get vaccinated and where you are on the plan. It's a good site. I'm glad it's there. As of right now, there's not a lot of firm details on when, or I should say, where specific groups will go. That's still all being developed. I got a call from a doctor's office in town. We've actually got several. When are they able to get it? And the answer is we're working with the state on what the mechanism is going to be for certainly smaller doctor's offices and smaller dental offices. Everyone falls somewhere into one of the phases. The plans just haven't been completely put together as to how that rollout is going to be. And that's not a perfect thing, but it's a challenging thing. We've done similar stuff. We've never done a true mass vaccination or mass inoculation of the whole population. So it's going to take time. You're seeing stories in the media, and I've said to everyone that you absolutely will, about some doses got dropped here, some doses got left out here. Those things do happen. I mean, when you think about it, if the goal in a 12-month period is to give 300 million people 2 shots, we're going to drop things. Things are going to get forgotten. They're going to be left places. You have good, nurses and health workers. They have good practices. They know what they're doing, but we are all human. People drop things. It's going to happen. I wouldn't overreact to any of those cases where those things happen. Vaccine does get spoiled because people left it out too long, or they put it in the wrong freezer. I know here we obsessively look at the temperatures of our freezers, but things can happen. You can have a dedicated outlet, and if the power goes out, it's supposed to get triggered to the generator, and then miraculously the generator doesn't work. Those things happen. This is a massive scale. I mean, I'm sure we've all had light bulbs burn out. Usually nothing happens when a light bulb burns out, but I'm sure sometime you've been there on Christmas morning or something like that when a light bulb burns out, and the circumstances aren't fortunate. So those things do happen. Check out the state website. Pay attention to information about the vaccine. I want to be clear, if you're getting offered the vaccine, it's going to come from a legitimate, reputable source. Right now, it's health agencies, hospitals, and CVS and Walgreens are doing congregate care shelters or congregate care settings. But again, if your friend Bob says, hey, would you like a vaccine? I have one, or this or that. Don't let people you don't know stab you with a vaccine. And you should make sure that it's either a nurse or an EMT or a doctor that gives you really any kind of shot, but neither here nor there. So it's going to come from legitimate sources. You will feel comfortable about it. The person in the back of a card shop that says they've got some from their friend whose uncle's a doctor somewhere, don't do that. Don't pay for it. If somebody offers you it for additional money, now it's hypothetically possible that people may, stuff can get stolen, it can get tracked, and they may get a hold of it. If you're paying for the vaccine, you're doing it wrong. Report that to the police. It's illegal. It's a scam. A question from Bob: was running a little late. Any need for volunteers to help with vaccinations? We don't think so yet. But where we might need is the next phase as we get into utility workers, because that's a large category. But we will let everyone know. We do have our medical reserve corps, but we have 3 nurses on staff on the town side. And then in terms of getting the schools done, we have an additional, it's either 9 or 11 nurses on the school side that are able to help as well. And EMTs can actually administer the vaccine. So once we're ready to go, we just need the vaccine and we can go. But if we do need volunteers, Bob, thank you for asking, and thank you for all you do for Norwood. We'll be more than happy to reach out and let folks know. That's all I have for COVID and vaccine. I'm going to go into some questions we got. We got several of them. The first one I got, and folks, again, feel free to continue to ask your questions here. The first question we get is, or we did get, was about the hospital, and I wish I had a better update other than they are still apparently fighting it out with their insurance company. I did talk to the hospital CEO today. We're going to try to meet sometime next week or the week after with Stewart and say, we're hearing this. What do you need from us at this point? Because this is going on longer than anyone really anticipated it to go on. And if there's a problem with an insurance company or something, you let us know how to help. If I got to call anyone and file a complaint, I will. I think Stewart's been open about sharing everything they have with us, other than they're waiting and they're not getting the answers that are helpful to them. So I wish I had a better update than that on the hospital. I feel like I've been sitting here since June saying, well, the update is there's no update. And the truth is, the update is there is no update, other than they're still working through their insurance process, which is starting to frustrate quite a bit of us. I did get an email from a gentleman, Derek, who is the owner of Perks Coffee, and he had a couple of questions here. So I'm going to go through these, and feel free to jump in any time with questions. So he goes, I thought it was ridiculous that the town couldn't waive the $250 health department and $100 common victual license fees. I think everyone's entitled to their opinion. What the Board of Selectmen did do was they cut back on the cost of liquor fees. So bars that were paying $5,000 for a license had that reduced in, I believe, half to $2,500. So could they have waived the $250 and the $100 fee? The $250 health department fee is the health department fee. That's true, they could have done that. It's a small amount compared to the liquor license fee, which is actually a loss of revenue. And remember that every dollar we reduce somewhere, and we do it, is a dollar that doesn't come from somewhere else. So I think that the thought on those licenses is that those are actually relatively inexpensive licenses compared to a $5,000 liquor license. We did not reduce auto license fees, I don't believe, and those can sometimes be a couple $1,000s, not too heavy. Those are the fees that the dealers pay. I believe that other than a few small grants, there's no other help to the small businesses in the area, correct? Well, I guess it depends on how you want to look at it. So in terms of direct grants, we used $80,000 of local funds, and we secured about $140,000 from the state in a competitive grant program. So the funds that Norwood was able to make available for small businesses was $220,000. I can tell you almost no town in our region did that. Some towns did the Shared Streets grant where they were able to help with outdoor dining. Our grants helped with that, and we provided all the barriers you saw downtown for the outdoor dining, 100% the town. I actually polled a couple of my colleagues on this earlier today, and Avon did nothing. Foxborough just helped get access. Let's see, Medfield, nothing. Medway, nothing. Westwood, nothing. Norfolk, nothing. Sharon, nothing. So the norm in the region was nothing. Norwood went above and beyond with securing $220,000. Remember, we're also the little guys, so the fact that we got far more than anyone in the region for our businesses, I think, is a big win. We certainly punched above our weight class there with getting those funds. There have been millions, if not billions of dollars of PPP loans. I've spoken to many businesses in town that have gotten PPP loans, and they've done pretty well. In terms of, in general, what else we've done to help for businesses beyond that $240,000, I think Central Street's a great example of that, which came at a cost to the town and was the envy of a lot of other towns. We had literally dozens of towns reach out to us and ask us how we did it, where the model is, how we funded it, can they have access to that funding, and what our plans were. More people were on Central Street this summer than any of our other parks. And the Parks and Rec Department, Travis and his team do a great job, but more people went to Central Street than anything else. And I think that's a great example of something we did to bring people downtown. We installed the sound system on the Common. That we got a grant for about a year and a half ago, but that was about a $35,000 system. Our outdoor dining, we were one of the first in the state. Our regulations that we redeveloped to work with this were actually copied by our regional planning agency. And again, we heard from probably 20 different communities, how can, copying our regulations. We were one of the first to get it out there on June 8th, the day outdoor dining became available. I have personally spoken to business owners in the downtown who have said that saved their business and they would be closed today if it hadn't been for that. We had no obligation to do that. Some towns outright said no, some towns did far less. So I think that's part of sort of our business outreach that we did. I mean, Dedham put up a picnic bench, Needham put up a tent. We also allowed fitness studios and karate studios, dance studios I should say, to use town facilities at no charge to have outdoor classes this summer. We had about 8 or 9 different businesses doing that, and we were able to, there were probably about 100 different sessions. So if you think of a dance studio or a karate studio and a fitness place that was closed for a period of time, We said, go use our parks. We're not going to charge you because we want you to be able to try to make some money. I have not heard of other towns doing that. We were ahead of the game on that as well. We did the East Hoyle Street. We did the parklets in South Norwood. If you do remember, in looking at our overall COVID response, and I know we're talking about businesses in particular, we did lose the hospital in the middle of all this and came up with $500,000 of local funds to help residents who lost portions of their home. Those were 100% local dollars. No money came from the state or the federal government. And statewide, the media coverage that we got for Small Business Saturday, I think was pretty exceptional. So I think if you look at what we did for businesses for a community our size and our wealth level, we've done more than our neighbors and more than peer communities. So I don't know what else the expectation would be, but I think we've done pretty darn good for businesses. 2 businesses where the town owns the property, the Old Colonial and Norwood Printing, we forgave a substantial amount of rent on those 2 properties. So that's a loss we take. Those are things I have to go cut out of my budget to help those 2 rental properties, because we looked at it and said, in that context, we're a landlord, what can we do? So I would hope other landlords would do that when they're available to. So I think for what a local unit of government did for business support, when the average was 0, we went well above and beyond. Find me other towns that are not large cities that have direct access to federal funding that did better than us, because we did more than Canton, Dedham, Sharon, Westwood, Foxborough, Walpole, Norton, Norwell, all the N towns, one of those even near. Norfolk is the town I was looking for. Medfield. I asked Medfield earlier what they did, and their town every year asks for $15,000 for economic development, and that's it. And they helped get a grant to help one place do some outdoor table dining. And again, all that outdoor dining that we did, the town provided all those barriers and everything, no cost. We also fixed the street in between the OCC, which is a town-owned building, and the Civic Center. We strung some lights up there. We strung the lights on Central Street and added lights to the downtown area as well. So I think our business response has been pretty phenomenal. Remembering that the community is focused first and foremost on our residents, and that doesn't even get to what we've done with the Norwood Fund, what we've done with the Mustang Food Pantry. I mean, I walked to the line of cars for the Mustang Food Pantry and saw waitresses I know and barbers I know that I use, and the people that needed food in the community. And Jerry Miller and his team and Cindy Durain and everyone that did that, our community response has been outstanding. We've raised a lot of money through the Norwood Fund, which is beginning, I gotta get an update on it. We're beginning to see a heavy drain on that. People are running out of money to pay their bills, to pay for food. Their oil tank is damaged. That's all what we've done. I'll take a pause on these questions to get to a couple of questions in the comments real quick, and then I'll go back to these. Residents, can you donate plastic grocery store bags to the library? They need lots and lots of bags so they can run curbside. Listen, Norwood, I know I have about 9 different bags full of bags at home, and I don't know why we all have this issue with getting rid of them. We always think we need enough to last an eternity. I'd say the average home, other than your trash barrel in your bathroom, we probably all have 100 of these, and our average use is about 4 a year or something like that. Even if you change your trash every week, that's still only 52. So we all have tons of them. So please, if you have plastic bags, bring them to the library. And Kate, we'll have Joe in my office get that out on all of our social media feeds to bring them there. I have some bags that I would be more than happy to donate as well. Quick question about town meeting from Catherine. If I send my email to the town clerk, should I be looking for an email soon about town meeting? Yes, we're probably sending out a tester email soon. If you are a town meeting member, you need to get your email address to the town clerk. You need to get your email address to the town clerk. Town meeting will be remote this year. You need to get your email address to the town clerk. Please, we've sent a printed notice to everyone. We'll be sending out a tester email soon. Town meeting will be done by Zoom. There's going to be 5 training sessions on Zoom that we're working with MAPC, our Regional Planning Council, to do. That information will be going out on our website soon and our social media feeds and on Norwood Community Media, and more information will be coming. We will be doing 5 training sessions on Zoom to get everyone set up, but you need to send the town clerk your email address. So I would expect an email in the next day or so if Mary Lou didn't get it out today about that. And if you've already sent in your email address to the town clerk's office, I want to thank you very much for that. It's going to make things a lot easier as we navigate our digital or remote town meeting. So jumping back to a couple of these questions, I wrote asking if the town could supply all of us with greatly reduced electric bills since the town brags about how much money it makes from the electricity and got no reply. So the challenge with that is, by law in Massachusetts, we can't sell electricity for less than our cost. So we're not allowed to do discounted electricity. We know we have that 10% early pay incentive. It's actually a whole different rate class, but we're not allowed to do under law a discount rate. Now, some states, particularly in the South and the West, they're allowed to do economic rates or incentive rates where they can say, hey, you're a big manufacturer and you want to come to town, we can discount your electricity for a couple of years. Remembering that we do buy the electricity, so anytime, even if we could reduce a rate, because we get the question all the time, well, Tony, the town owns the light department, why do the schools have to pay electricity? Well, that money has to come from somewhere because we still have to buy and transmit that electricity. So where does that money come from? Even if you can do it, it's one of two things. We reduce the revenue the town generates, which means that's cutting money out of the operating budget or raising taxes. So I don't think cutting people's electric bill and laying off teachers is a good idea. Or it's the rest of the ratepayers that pay it. So how do we decide who gets an incentive rate? Even if we could do it, even if we could discount an electric rate, so do we give it to a small business and say, all right, well, they're a small business, so their rate is maybe they're paying $300 a month or $500 a month or $1,000 a month. We're going to discount them. Well, who should pay for that? Is it a senior citizen who maybe only uses $40 a month in electricity and is low income? Or what about our big users? Because the bulk of the money we make is actually, we have some people whose electric bill is $100,000 or $150,000 per month. So those customers, thinking about it as a business, could get upset and say, hey, wait a minute, this person over here pays $2,000 a month and you're giving them a discount. I'm paying $150,000 a month. So it's a combination of it's not allowed anyway under state law. And even if we could do it, who gets a discount on electricity? Is it residents? Is it businesses? Because I can tell you, if we tried to give smaller businesses, I know that sounds great that we'd be giving smaller businesses a discount, the people that pay a fortune, and they're big companies, so I'm not inclined to feel bad for them, but they would say, wait a minute, we'd be facing a rate case before the Department of Public Utilities because they'd say, we're the ones paying for the cost of everything, and you're cutting somebody else's bill. So I wish we could do it. Massachusetts is not a state that allows anything like that. We cannot cut people's electric bill. We can't give you a discount. We can't say, don't worry about it, you don't have to pay it. When we have people that have a problem paying their bill and we're able to help them through our Gift of Warmth Fund or through the Norwood Fund, we still have to take that money from that fund and pay that money to the light department because it's state law. It's considered fraud if we did it any other way. We can't lose meters. We can't stick pins in meters. Those things used to happen years ago. It's not a possibility. The taxpayers pay the electric bill on all of their buildings to the light department. Now indirectly they get it back, but that's the only way the system's allowed to work under the law. I asked if the town planner and his assistant have come up with anything other than to hand out unused Norwood Day buttons to increase foot traffic in the area and got no response. Well, I'm sorry you got no response. It might have been the way that that question was phrased because all of our outdoor dining in Central Street, we take a team approach. That wouldn't have happened without the Community Development Department. The Community Development Department in the last couple of years has also focused on their full mission of community development. So in terms of just increasing traffic in the downtown, one of the things that they've done, they were a part of Central Street. They were the ones who wrote the regulations on outdoor dining, and I think that's been fantastic. They took the lead in pushing to redo the town parking lots. We spent $1 million on parking lots this summer, making sure that our downtown looks really good. So in terms of increasing foot traffic, we work regularly with the Friends of Norwood Center. We pushed Small Business Saturday this year. We got statewide media coverage on that and tied it in with our Norwood Day. So my response to that would be, I think they've done all that a planning department is expected to do. Their job is not to increase traffic. We want traffic to increase. The largest downtown zoning change that we've had in 30 years, and it may still not be adequate, was led by the planning department. So I'd suggest reaching out to the Friends of Norwood Center, who's really promoting Norwood Center, and talk about that and see what they've been doing, what they've been engaged in, and how we can work with them. Because I know the Friends of Norwood Center have told me they're thrilled with the town's response and everything we've done, and so is the Chamber of Commerce. One more question before I get to two questions here on the live. And again, these are all coming from Derek, who owns Perks downtown. I asked if the town is going to start reducing the assessed value of the buildings in the downtown area since commercial real estate is down 30 to 40% and got no response. I'm not sure who you emailed that to. That's a question for the assessor. What you have to understand is the way that buildings are assessed. There's two models. One is a revenue basis. So, for instance, a warehouse, you might say, well, it's an empty building, but how much revenue are they generating? Are they renting that space out? You know, an office building is sometimes that way. The other one is the actual value of the building. Now, saying it's down 30 or 40%, that might be a news line that you read, but values haven't dropped 30 or 40%. I'll tell you, if the value of a commercial building downtown on paper has dropped 40%, I'm going to go out and buy them right now. Home prices are going through the roof. We know there's a challenge with the commercial sector in bigger cities that hasn't bled its way down. It actually takes a while for that to bleed down into cities and towns. So one of the things that I would suggest is always contact the assessor if you feel that your assessment is somehow out of line. But at the end of the day, the building is the building. And commercial values or commercial tax rates are going to continue to go up as the residential value in town continues to increase, as the portion of the balance of the tax base shifts to commercial. But if you have any questions about your assessment or whether it's too high or not, you can contact the assessor's office. I can also tell you there's never been a sort of region-wide or area-wide reassessment of buildings that changed commercial buildings 30 to 40%. Commercial property values are largely flat in this region. And last, more of a comment, sorry, but the people in Norwood Town Hall get an F in my book. Well, I respectfully have to disagree, Derek. I think they get an A+ in the book. I know you're concerned about your business alone, but this is a community, and we focused on people first, and our business response I'd put up against any other community in our region. None of our surrounding towns, including I believe you live in Medfield, have actually done anything near what we've done, so I guess I respectfully disagree. Question from Sheila. Any new updates on our new process for bulk items or TVs? Yes, we have added it to our suite of software changes as we're converting our accounting software over. We've actually converted the accounting software over. We're having a software platform called EnerGov, and that's going to allow for a whole variety of online permits, and the sticker process will be a part of that. We're also looking into whether or not we can have the stickers available for sale at some retail locations in town. It's a little tough to have those conversations right now because everything is kind of difficult, but some towns sell, for instance, their bags at a grocery store or a convenience store. So we're looking into whether we could do that as well. So that way you can get a sticker. Online is the goal, but if you need a bulk item sticker, we'd like to be able to get them out there in the community so you can go and say, hey, I'm doing my shopping at Shaw's or Cedar Market or wherever. Can I also get one of those stickers? Yep, here you go. Here's the sticker. Just to make it easier, because I know it's, oh man, I got to call town hall and I got to go into town hall and this and that. Always call us if you need one. We'll find a way to do it, but we're looking at that digital route, as well as looking at once things open up a little bit, maybe by the spring, we'd hopefully be selling them from a couple of places in town. How does someone get nomination papers for town meeting members? You contact the clerk's office. We have the website or the link published right there that talks about how to run for office. You get your nomination papers. They do need to get signed and they do need to get in. Every year there's a number of town meeting seats open. This would be for the election that will take place in April, for town meeting that will seat in May. The February town meeting that we're tentatively having February 4th is for individuals who have already been elected, but I'd encourage you to do it. It's fairly easy to get on the town meeting. Town meeting makes some really good decisions, some really important decisions. They approve our spending every year. They approve our land use every year, as well as our capital plan every year. So I'd encourage you to do it. I believe nomination papers are available now, and I want to say that nominations close around the middle of February. The information will be on the website, but so there's another, I'd say it looks like 6-ish weeks, 5-ish weeks to get your signatures in. Whatever the number of signatures the office requires, please always get more, because the clerk's office does have to verify them, and sometimes people, they just forget that they've moved, or they think they live in Norwood and they live in Westwood and they say, sure, I live in Norwood, and they sign it and they don't realize it. So I think town meeting might only be 10 signatures. I always tell people get 20 or 30. If a school committee seat requires 50, get 100. It is a little tough now with COVID, but people have come up with creative ways. Back in the spring, Colleen Brierly did, with putting sort of a table in front of her house and then putting it out on social media. And I think that's a great idea and a great way that you can do some of that as well. So great question there, and we are looking forward to a few of those things. That comes to the end of the questions that I've received, and I'd be happy to take any questions in the comments or any questions everyone else has. I did mention the hospital. The only unfortunate update we have is that there's still no update other than they're working with their insurance company, and we certainly hope that to have some more of a formal update in the next couple of weeks. We should be hopefully meeting with them formally, I'm hoping next week or the week after. Plastic grocery bags, we all have hundreds of them. Please bring them to the library. If anyone has any additional questions, we're always here. You can always email us at managers@norwoodama.gov. I am going to make sure I checked through all the questions. I believe I've gotten everything. The vaccine is coming. We will be vaccinating first responders starting Monday, and we can't wait. Look for that on certainly our social media feeds, as well as the, it might make the news, and you'll see Chief Maurice and Chief Brooks getting their shot. With that, I want to thank everyone. I hope you have a happy new year. I hope you had a wonderful holiday season. I know things are a little tough right now, but vaccinations of first responders start Monday. We are almost through this. These are officially now COVID and vaccine updates as we move forward to the next phase. And hopefully by the summer, it will be a thing of the past, or mostly a thing of the past. Karen, great question. Just call the clerk's office. They'll make sure they get it to you. They'll either deliver it to you and have you come and come to the door and deliver it to you, or they'll mail it out to you. Either way, they will make sure to get you your paperwork no matter what. Town hall is closed, but just call us. We can take care of any service that we have. Thank you everyone. Thank you, Kate. Thank you, Kate. Both Kates, Kate Squared. I hope everyone has a wonderful weekend, and we will see you next week as we're going to continue our lives every week. Feel free to reach out to us if you need anything at all. Thank you, everyone.